Welcome to our podcast. Today we'll be sharing an incredible story about perspective, resilience, and the power of knowing your journey. That's why our mission today is crucial: cancer awareness. We're here with leading specialists to discuss the absolute importance of awareness, not just for finding a cure, finding it early. Stay with us as we talk to our experts about turning awareness into action and making sure every single person, old or young, has a fighting chance.
Today, we have the pleasure of meeting Ms. Noor Barakat, a clinical dietitian with 10 years of experience in the field of nutrition and health. Throughout her career, she has helped many people develop a healthier lifestyles and guided patients, including those of cancer, following a diet that suits their needs. Ms. Noor, hello.
Hello, how are you?
Fine, thank you. Okay, so starting with our first question. How does nutrition affect cancer treatment, outcomes, and recovery?
Okay. Good nutrition plays a major role in how the body tolerates cancer treatments like radiation and chemotherapy. Eating well helps maintain body weight, muscle strength, support the immune system, and improves recovery after each treatment. Nutrition helps the patient feel stronger, heal faster, and handle the side effects better.
What are the most important nutrients or foods to focus on during treatment?
During treatment, the body needs protein from fish, eggs, and dairy for tissue repair, needs complex carbs from whole grains, fruits, and veggies for energy, healthy fats from nuts, avocados, olive oils for supporting the immune system, and plenty of fluids for hydration. If the patient struggles to eat, small frequent meals can help.
Good to know. Are there any foods or supplements that cancer patients should avoid?
Okay, yes, for sure. Raw or undercooked foods such as sushi, raw eggs, and unpasteurized dairy products. Processed foods, high sugary foods and drinks, and high dose supplements, especially antioxidants like vitamin A and a vitamin E, which can interfere with the treatment, so should be taken under medical supervision.
Okay, it's such a great info. How can diet help manage side effects like nausea, fatigue, or loss of appetite?
Okay. For nausea, we use small bland meals such as crackers, toast, and bananas, and we avoid strong odors. For fatigue, we focus on foods that are rich in iron and vitamin B, such as lentils, chicken, and for loss of appetite, we use snacks that are easy to swallow.
Okay, sounds great. What are good meals ideas for someone who struggles to eat or taste food during chemotherapy or radiation?
Okay. We use smoothies with milk, banana, oats, and nut butters. We use soups and purees from lentils and veggies. We focus on yogurt with fruits and
Interesting, yes.
honey. Also mashed potatoes, oatmeals, pasta with olive oil. And if the patient is feeling a metallic taste, it's important to use plastic utensils or add lemon or some herbs for the food.
Okay. What should a cancer survivor's diet look like to reduce the risk of recurrence?
A cancer survivor should follow a balanced Mediterranean style diet with plenty of fruits and veggies, whole grains. He should eat healthy fats from nuts and avocados. He should be eating lean meats from fish, beans, and eggs. He should follow a diet low in processed foods, sugars, sugary drinks, and foods. He should stay active, maintain healthy weight, and avoid tobacco and alcohol.
Okay, nice. Are there specific foods known to help strengthen the immune system after treatment?
Yes, for sure. We have vitamin C, like citrus fruits, kiwi, bell peppers, vitamin D from eggs and seafood, zinc from seafood and nuts and seeds, probiotics from yogurt, kefir, and antioxidants from berries and green tea. A varied diet with plenty of colorful fruits and veggies naturally boosts immune system.
How do you adjust dietary plans for different types of cancer, for example, breast, colon, and prostate?
Okay. For breast cancer, we focus on plant-based foods and omega-3s and maintain healthy weight. For colon cancer, we increase fibers from fruits, veggies, and whole grains, and we avoid red meat. Prostate cancer, we avoid high fatty dairies, processed meats, red meats, and include tomatoes and green teas for antioxidants. Diet depends on each case, on the side effects, on the treatment, and the personal preference.
Okay, it's such a great plan. How can patients balance getting enough calories and protein while still eating healthy whole foods?
Okay. We use calorie-dense but nutritious foods, like we add olive oils to meals, nut butters to snacks, and milk to soups. We choose natural sources over processed ones, and the goal is to maximize the nutrition in small portions, especially when the appetite of the patient is low.
Sounds interesting. What are some common diets, fables about cancer, like sugar-feeding cancer, or what's the truth behind them?
Okay, that's one of the most common myths.
Yes.
All cells, healthy and cancerous, use sugars for energy. Cutting carbs at all will not starve cancer. Instead, we should focus on complex carbs for energy. Other myth is that superfoods cure cancer. No single food can cure cancer. It's an overall diet and a healthy lifestyle that does magic.
Okay, we truly appreciate your time and the expertise. Ms. Noor, your answers were both inspiring and informative. To end our discussion, what message would you like for today's teenager to maintain a balanced lifestyle?
Okay. The main guidelines that we focus on are to eat healthy, real foods, stay hydrated, avoid processed foods, be physically active, avoid tobacco and alcohol, stay fit with healthy body weight, and undergo regular screenings and checkups.
Okay, thank you.
Welcome everyone, Lawrence here, and today we'll be diving into a crucial conversation around the women's health and wellness, the importance of early detection and proactive screening. I'm thrilled to be joined by our special guest, Mrs. Malak. She is a dedicated and experienced midwife. Midwives play a vital role providing guidance, being women's support and source of care, and building trust with her. Hello, Mrs. Malak.
Hello, dear.
Thank you for being a part of this today. In our discussion today, we'll be covering all concerns about the importance of early detection and screening. Okay, let's begin with, how do you educate women about the importance of early cancer detection during pregnancy checkups?
Okay. During antenatal visits, I teach women about breast self-examination and emphasize reporting any new lump, nipple discharge, or skin changes. I explain that the pregnancy can make breast feel different, but also early detection, even during pregnancy, improves the prognosis and allows safer, more effective management.
Amazing. Now, what role do mammograms play in early detection of breast cancer?
Mammography is the gold standard screening tool for detecting breast cancer early, often before a lump can be felt. It uses low-dose X-rays to identify microcalcifications and small lesions that may indicate early malignancy.
Nice. What are some differences that make early stage checkups essential from that in late stage?
Early stage detections means localized tumor, minimal treatment, and high survival rates. Also, it can be curable. Late stage detection means it is a metastatic disease, complex treatment, and poor prognosis. Thus, screening and early diagnosis are critical for better outcomes.
What are some methods that you recommend for detecting breast cancer early?
Breast self-examination after menstruation, that is after 7 to 10 days. Clinical exam done by a doctor or a midwife, that is done yearly. Mammograph every 1 to 2 years after 40 years, and for high-risk women, earlier. Ultrasound or MRI in case of high-risk women.
Pay attention to the dates that the midwife just mentioned because they can be important for women to check out for cancer early. Now, lastly, how do midwives support women to take action and follow up with them if they suspect something during pregnancy?
As a midwife, I support women by providing education, reassurance, and follow-ups after abnormal findings. I also offer emotional and psychological support. and encourage adherence to treatment and diagnostic procedures.
Amazing.
you.
Thank you.
Thank you for you too.
It was a pleasure meeting you, and thank you so
Same.
much for your support.
Same here, dear. Thank you also. I wish you good luck
Thank you.
in your future career.
Knowing that mental health is of great importance for any patients and their families. Our guest is Mr. Aslan Bultaif, who is the representative of PHCC in regard of their mission in spreading awareness and following up with patients after being diagnosed with cancer. Okay, so what is the biggest misconception about psychology?
That therapy is only for crazy people, which is something wrong. It's for everyone, anyone facing emotional or life challenges. He could be visiting this therapy, and it's like any normal doctor visit.
Yes. What's your institute's approach to therapy?
It's not only my institute as a person, it's our institute as a team.
So you work as a team to help the patient?
Yes, yes, sure. This therapy we work on CBT therapy, which is focusing on the patient to feel himself part of this therapy and part of the progress.
That's a good point.
Yes.
How do you measure success in therapy?
Every smile is a success in therapy. When the patient feels himself
You feel
involved,
like a success.
yes, involved in with the society, and with this therapy, with the team he's working with, this is success.
Yes. What methods do you rely on to help cancer patients open up to you?
This is very important. It's a long process, but first of all, you should listen well and show some emotion to the patient.
So they open up to you?
Yeah, you gain them their trust. Yes, then they will open.
When someone feels like giving up, how do you help them become strong?
You should see the reasons behind their hopeless, and always remind them why they are here.
Yes. Do you seek help of family members?
If the patient has a good link with his surroundings, and this could help, yes, why not?
So when he faces difficulties?
When you face difficulties with the patient, you should, if this helps, you should go to his family.
What self-practices do you recommend? Do you
Sleeping
think,
well.
making exercises?
Yes, regular
Yes.
exercises, sleeping well, having a health body and health mind is
Exactly.
very, very important.
Yes. Any advice for someone starting therapy?
Yes, he has a long progress. He should be patient,
Yes.
and he should be honest with his therapist.
Yes.
Yes, will gain at the end.
What is the most important points a patient should focus on with you?
To be honest,
Yes.
to tell me every feeling he can feel, and shedding light on his difficulties.
Thank you.
Thank you. Thank you for shedding lights also on this program. Keep going, and this is very important thing to help others and raise awareness. Raising awareness. Thank you.
Good morning, everyone. Today we are interviewing a special person whose presence brightens any room, known for her knowledge about health, sport, and inspiration. They always leave a lasting impression of confidence and grace. Ladies and gentlemen, we are interviewing Rawan Abu Said.
Thanks for this introduction. You made me speechless, actually. Thanks for having me today. I'm happy to be here.
Nice to meet you.
Nice to meet you too.
We will begin now with the questions. How do you think regular exercise can help lower the risk of developing cancer?
Simply, we can say that exercise is the most powerful medicine that doesn't come as a pill. Okay, so in general, it keeps our body balanced, active, and full of power, which gives the body more power or strength to fight any disease. It boosts immune system. It reduces inflammation and strengthens our body. So it will be better in detecting abnormal cells.
Okay. In your opinion, what types of physical activities are most beneficial for maintaining good health or preventing diseases like cancer?
Honestly, the best exercise is the one that you enjoy. So it may be walking, running, swimming, yoga, meditation, anything that you can do it regularly. So it's about doing it every day.
And you have passion for it.
Yes, exactly.
How important do you think it is to stay physically active during cancer treatment or recovery?
Being active is always important. When we have a cancer treatment, we need to have doctor guidance, but it's kind of stress release. So during the treatment, we really need to release our stress, to be active, feel strong, feel that we are really still doing something.
Okay.
So it's truly important to remain active always, no matter what's the case.
Can you explain how physical health affects the body's ability to fight cancer cells?
Sure. When you're active, your body produces more immune cells that can find and destroy any abnormal tissue or cell or harmful cells. So exercise also helps your body repair DNA properly and reduces stress on your organs. Basically, it makes your body defense system smarter and stronger.
That's true.
Yes, exactly.
What role does a healthy lifestyle, including diet and exercise, play in cancer prevention?
It really matters. Stay away from fast food, sweets, and focus more on eating vegetables, fruits, every source of protein. That would be great.
Can we rely only on a good diet?
No, we can combine that with being active, having enough time of sleep, being hydrated. Then, combine that with exercise, getting enough sleep, staying hydrated, and not smoking. So you're already cutting down your cancer risk in a big way.
Can we consider that sleeping 8 hours is sufficient?
Sure. Having enough time of sleep is a big support to your body.
Okay. What advice would you give to people who want to reduce their cancer risk through physical health?
Exercise is amazing for mental health. It releases endorphins, those feel-good hormones, which help reduce stress, anxiety, and depression. So for someone battling cancer, it can bring back a sense of control and confidence. Even gentle movement can lift their mood and remind them they are still strong.
Thanks for the new information. Do you think awareness about the link between exercise and cancer prevention is strong enough in our community?
Not really. I think we still have a long way to go. Many people see exercise as just a way to look fit or to spend time, but it's really a form of medicine. Schools, families, and communities can all help spread the message that movement keeps us healthy and strong for life. And health begins where movement lives. So in the spirit of sport, it is in the spirit of sports.
It was really a pleasure having you with us today. Do you have any final messages you want to share?
It's my pleasure too. And please remember that taking care of your body today is the biggest investment you can make to your future. Take care of your body because it's the only place you should live in.
Hello everyone, my name is Lien and today I will be interviewing Leah. In this interview, we'll be talking about her grandmother's inspiring journey with breast cancer, the challenges she faced and the treatments she went through, and the strength that helped her and her family through it all. So, my first question for you is, can you tell us about a little about your grandmother and her journey with breast cancer?
Yes, of course. My grandmother's journey with breast cancer started in July 2024. She began feeling with pain and weakness, and after many tests, doctors discovered that she had a cancer in her left breast. And with her faith in God and our support, she became cancer-free in March 2025.
Glad to hear that she got over it. What was your reaction when you first heard the news?
When I first heard the news, I felt with so much of sad and fear and shock, especially when someone so special for me was going through something so serious. I cried at first, but at the same time, I stayed positive and I promised myself to stay positive and to be by her side no matter what, and to always let her feel that she is not alone in her
So
journey.
sorry to hear that. treatments did she undergo?
She first did the chemotherapy and she did the surgery, and after that she did the radiotherapy, and after that she is now in the immunotherapy.
When did she start the chemotherapy?
Since 27/7/2024.
She had side effects, right?
Yeah.
What kind of side effects did she experience during?
Yeah, of course. Especially after the third session of chemotherapy, her hair started to fall out and she had a frequent nausea and frequent dizziness.
What role did you personally play in supporting her during that time?
I think I played an important role in her journey, especially when I started taking care of her and being by her side and giving her hope that she will be better by days.
Nice. So what message would you like to share with other families who are going through something similar?
For the families that are going through my similar situation or similar journey, I know how hard it is and how exhausting it is, but I want to say to never lose hope. Believe that healing is possible. Love, faith, and patience can make a very huge difference.
Yes, they are important. Okay, what do you think young people can do to raise awareness about breast cancer?
I think young people can make a huge role in sharing awareness about breast cancer or any type of cancers. They can start with sharing information on social media and organize school walks, events, and fundraisers about cancer patients. Most importantly, young people should know about self-examination and how to support their mothers, sisters, and friends, and to do early checkups and daily checkups. Awareness can start in one simple conversation.
Yes, thank you for sharing this experience.
You're welcome.
When she was 3.5 years old, she was diagnosed with Ewing sarcoma, a rare disease that affects the bones. She went through many treatments and tough moments, but she never gave up. Now, at 19, she's here to share her story with us and inspire us with her strength and courage. Welcome, Maya. It's such an honor to have you here.
Thank you for letting me talk about my experience.
How long did it get you to get cured?
It took me 2 years to be fully cured.
And did you use chemotherapy?
Yes, I used chemotherapy alongside the other treatments I took, such as radiation and surgeries.
Wow, that's actually a pretty long time. What's one moment you'll never forget about your treatment?
The moment I had to say goodbye to my hair, I was panicked, screaming and shouting, surrounded by nurses and mom trying to persuade me, even though they cut their own hair to show support. I kept saying no, but finally I just had to let them do it.
Your mom and the nurses were very supportive to you. Is there anyone you miss from that journey?
Yes, I still miss my friend. The moment I found out that she had died, I was wearing a pink and white dress, running to her room to show it to her. Her mom fell to her knees and hugged me and said she left to a better place. And then I realized that she had actually died. This still hurts me because I always think, what would happen if she were alive and we were like other besties?
My condolences to you. Your friend must have been a very strong girl.
Yes, yes.
Looking back at yourself, how would you describe your journey using one word?
Power, because if I wasn't strong enough, I wouldn't have defeated cancer and overcome everything that comes with it. So I survived bullying for losing my hair and for everything that my body went through. I am strong now because if I would go back in time and serve and experience this, I'd choose this journey because it makes me fearless and proved my absolute power.
You are a very strong person.
Thank you.
Was there any moment you felt weak in?
Yes, there are many times I felt the weakest. When I had to stay in the hospital while other kids are playing outside, I'd look at myself and say, why me? Why can't I eat what they eat? Why don't I have hair like they have? That feeling of being so different is exactly when I felt truly weak.
How did you manage to get through all these struggles as a family?
As a family, we stay close and we support each other. They never let me feel alone, and they gave me hope. They made me laugh, and they believed that I would get better even when things are getting hard. Their support gives me strength to keep fighting.
Family actually gives a very good perspective.
Yes, exactly.
You went through many challenges. One of them was radiation therapy affecting your growth, leading to losing your breast. How did you cope with this experience?
At first, I was heartbroken, crying, saying, "Why me?" I was ashamed. I couldn't wear what I want to wear, but now I know my strength and I accepted my reality.
There's a lot of women or girls are facing the same thing you faced. What message would you give them?
I want to say to every girl fighting this battle, you are strong and you are powerful. Your strength is inspiring. Don't be ashamed of what you have. Be proud of it and speak about it openly. The one who truly loves you will love your strength, not just your shape.
Lastly, what message would you like to share with people, especially kids going through a similar experience?
For every kid fighting this battle, I was in your place and I know how painful it is. But please know this, you are stronger than you think, you are powerful, and you will overcome this. Believe in yourselves. The world is waiting for you to hear your stories as survivors.
Thank you again, Moya, for being here. I'm pretty sure that everyone watching here has benefited from Maya's story.